Hi there. My name is Olivia Kate, and today I'm here to talk to you about reducing drug abuse on college campuses, specifically full time college students between the ages of 18 and 24. So, students come to college to try new things. They want to get involved with drama, meet new people, try new sports, and specifically focus on their studies, their classes. Unfortunately, there can be a few bumps in the road along the way, and one of those bumps is drug and alcohol abuse. Although alcohol is a drug for the purpose of this video, I'm just going to distinguish between the two of them. So, drug and alcohol abuse is something that we see a lot in college. Some of it legal, some of it not, as 21 and up is within the 18 to 24-year-old range. A lot of drugs, illicit drugs, prescription drugs, those are not necessarily those are not necessarily legal. Within the state of Wyoming, marijuana is not legal, while in other states it may be. Drugs like cocaine and heroin, though, are not legal anywhere. Um, so that's what I'd like to talk to you guys about today is how important we get this drug abuse down to almost zero. We see students use drugs and they do not think clearly. They make poor decisions and they don't see that they're making these poor decisions. And this affects pretty much everyone around them. Drug abuse does not just affect the person using, but as well as their family, their friends, and even some of their peers in the classroom. Most students that use it, you'll see effects such as nausea, they will have extreme mood changes, increased heart rate, and a lot of students, they're actually wasting their money by doing this. So they're already not making very good decisions coming into a new place that should be a place where they will grow and become better people. So we have seen an increase of drug use up over the years. I just used cigarettes as a slight picture, but this is actually in all drugs, Xanax, Valium, Adderall, alcohol as well, marijuana has all seen an increase over the years. And this is just not okay. Um, Ideally, what we're trying to do is not by reducing the drug abuse, we will then reduce what has been gained over the years. We need to get this under control over all schools, and this um, by decreasing, we're then actually helping the United States as well. Kids in college are our future generation. They're the people that are going to be leading us in the next couple hundred years. And if we start getting drug abuse down in colleges, we can further get down drug abuse across the nation, I believe. So um, some programs, some companies that are trying really hard to to focus on the health of our students and get down the drug abuse are companies such as American Addiction Centers, the company Dare, the online program Aware, the company SBIRT, which I will get to later, and Culture of Respect, which doesn't necessarily touch on health and drugs, but more on sexual assault, which has actually been found linked to people who do get involved with drug abuse and drug and alcohol abuse. Because it's seen very many times at parties. People are inebriated, they don't know what they're doing, and they a lot of times get involved with sexual assault. So I included that as well. So the company SBIRT is a company that I specifically think that should be implemented in all colleges, both on campus and nearby healthcare centers. So SBIRT is is a multi-step process, which I believe is most beneficial in getting students to get help and will later help more and more students. So the S in SBIRT is universal screening. So what this does is it's a 10 to 15-minute quiz that screens them to see what sort of risk they're at, what sort of risk that these people are at, if they're high risk, low risk. It's just a screening just to see what they look like. So then there's a brief intervention. This then labels them, and depending on what kind of help they need, if maybe they have a drink once a month, I'm sure that would be a low risk, but I'm sure if they were using marijuana 2 times a day, plus cocaine, plus drinking, I'm sure that would be a high risk person. So they use these different levels to determine what sort of treatment they are, which is the next level is treatment. So the treatment that they can get, so the company itself does not do the treatment, but they will then refer them to a treatment center depending on what they need, which I believe this is the most helpful because people who need help or finally come to the realization that they need help believe that they have to go straight to rehab, but I believe that people who need help, it's a sliding scale. It's not just one or done. It's not black and white. So this treatment, it can be anything from a slight therapy, they could need nothing at all, or it could be that they do need to go to rehabilitation. So then there's this follow-up after, which is not technically part of it, but they do keep up on their patients to see how they're doing to make sure that progress is happening. I believe this step or this program can be really great for everyone just because of how intricate it is, and they have professionals on each team that can help each patient, and everyone is different. And I believe that this can truly make them feel like there is hope for them. So then this comes to getting this program into the colleges, into the college campuses, into the nearby healthcare centers. I believe that colleges themselves need to implement this. After doing multiple doing research on this, I found that when I looked up how colleges are helping students about drug abuse, it mostly came up how students should be aware of drugs, like as if the college had nothing to do with it, when students are coming here to learn and to become new people after this. And I feel that college campuses have a responsibility to help students not get involved with drug abuse. So SBIRT, if this was in college campuses, they can get the word out, make sure people are informed of it, have a representative at each healthcare and college campus to know what this is about, and really educate students, not just on how they can get help, but how can they stop themselves from getting involved in the first place. And I think that is really where college campuses should hit home. So overall, in summary, I believe that we can help students. We can help those before they've even been affected. We can help those that already are affected. Drugs are such a nasty thing in people's lives that prevent them from going on in life. And unfortunately, college students are some of the highest people to use alcohol and drugs, which makes sense because college can be a stressful time, but there are so many better ways to handle that stress. So if we prevent them from getting on that path to drug abuse, we can save millions of kids and help them go on to a much better life than what drugs have in store for them. Thank you very much for watching, and I hope you enjoyed learning a little bit about how college campuses can prevent drug abuse in their students.